Thank you.
Thank you, Steve. Good afternoon, everyone. My name is Maika Sanderson. I'm Deputy Director for Public Health AmeriCorps, and welcome to June's Grantee Exchange. So today's focus for our virtual discussion is about enhancing your program training to improve impact. It looks like we may have a pretty small group this time. Typically, we have upwards of 20 folks join us for these discussions, but it is summertime and we're close to the 4th. So I think some folks are out on vacation or trying to wrap up work to be ready for their vacation next week. But we will still have a good time and still have a productive discussion today. I'm super excited to dive into the questions that we have for you all so we could just hear a bit about how everyone is approaching their on-site training for their members. How does CDC TRAIN kind of fit into that? And then what are kind of some tips and tricks for kind of doing your collective training for your members even better so that we can have more impact in the communities that your organizations are serving. So welcome, excited to have you here with us today. So if you can, just so we could get a feel of like who's in the room with us, if you could please drop your name, title, what organization you represent. And then we always like to start these off with an icebreaker. So we are in the midst of summer holidays. The 4th is coming up. So if you don't have an invitation, you are being virtually invited to PHA's cookout. And we want to know, if you are invited, what famous family dish would you bring to the PHA cookout? So if you could go ahead and drop that response in the chat, that would be amazing. I'm happy to start that off. For me, my mom is actually like an amazing cook. I can't quite fill her shoes, but one of the dishes that she brings and I'm pretty good at is her potato salad. And we do a mayo-based potato salad, but everyone always is like, who made the potato salad? And they're trying to take some home. So that's what I would be bringing to the cookout. I just want to welcome folks who are dropping their responses in the chat. Hi there, Michelle. Love that you are hollering out from New York City service and that you would bring tacos. I see here that Shelly, she would bring mom's baked beans. I love that. So thank you y'all for dropping in your icebreaker. For folks who may have just joined us, you're invited to the cookout. Tell us what kind of famous family dish you would be bringing. All right, so let's go ahead and transition into our next slide. So just a quick orientation to what we'll be doing. I've already welcomed the group. The next thing that we're going to be doing is jumping into small group discussion. If this is your first time at a Grantee Exchange, we love to start these off with getting connected and talking with one another. So we typically break up into small groups. I'm not sure that we'll have enough people to break out into the like 4 breakout rooms that we have available, but we'll take a little head count in just a bit to see if we'll stay as one large group and have a big conversation or if we'll break out. If we do end up breaking out, we tend to come back as a group and do some large group sharing for a couple of minutes just to hear what happened in the other rooms. And then we love to kind of round out these conversations with having a subject matter expert come talk with us a little bit about the topic at hand, which for us is about training and how do we enhance it and make it better so that we could equip our members with the skills that they need to have the most impact in the communities that they're serving. So super excited to be joined by one of our cooperative agreement partners, the National Network of Public Health Institutes. They have done a fantastic job at taking a look at CDC TRAIN and figuring out how to better enhance that training curriculum that we make available to all of our PHA members and that they're expected to complete by the end of their service term. So we have some changes coming down the pike for that requirement and the curriculum that's offered there. So Laura is going to give us a little bit of an overview of of kind of their approach to improving that training. I think some of their approach y'all can use when you're thinking about the training that you offer your members. And then at the same time, you get to find out what are the new goodies that are being offered in the new training plan that will be made available to PHA members coming soon. So more details there. We also have Dr. Aretha Costley, our training program manager here at PHA, to kind of round out that presentation of like, what does this mean for you in terms of these new CDC train updates coming down the line? And then we'll just close out with a few quick announcements. So we are super excited to jump into today's conversation. So what I'm going to do now is we're kind of working on the fly here. So we would typically go into small group discussion, but how many folks do we have in the room that isn't staff? I think we are at 7, if I'm not mistaken. Is there a way for folks to raise their hands or come off video so I could just see how many people we have? I'm just trying to decide if we should break out or stay as a large group. Okay, I see a hand. Okay, I see hands being raised. So we have 1. If you are here to enjoy, if you are a participant, can you just raise your hand for me so I can see how many folks I have for breakouts? So Tyranny raised her hand. I think that's Deshay. I'm assuming Alexis is also one. Amanda. Okay, so 1, 2, 3, 4. I think we can stay as a large group then. So what I'm going to do is this. Let's stay as a large group. And can I have folks take off their video for me if possible? So we typically like to do these kind of face to face, if you will, so we could just have the opportunity to see one another and connect. So if folks are able to come off video, that would be fantastic. And I guess what I could do here, I feel like this is very boring that I'll be talking a lot, but I will facilitate our large group discussion here. So Steve, is it possible to pull down the slide so it could just be us seeing the tiles across the screen? Yes, love that. Great. All right, awesome. I also want to just flag for folks, we do have some staff in the room. So I just welcome Liz Rose and Ann Druskowski, who are both portfolio managers for the Public Health AmeriCorps program. They were going to facilitate some larger breakout sessions, but we're going to do this as a big group. All right, great. I just want to make sure that I have everyone. So Alexis, are you going to be chatting with us today? I just want to make sure that folks can come off camera if they can. Okay, no problem, Deshay. We appreciate it. All right, so let's get started. Let's jump into the conversation. So the first thing that we want to do is just very quickly, I know you dropped it in the chat, but starting with Shelly, can you just very quickly go ahead and share your name? What state are you hollering from, your grantee organization, and go ahead and share that family dish that you said you'd bring to the cookout.
Mom's baked beans, they're always a hit. And I guess the secret ingredient is to use Bush's home-style baked beans as your base. That's it. But I'm Shelly Kaiser. I come from Wisconsin, right in the center of the state, and I'm with Marshville Clinic Health System. And we're running a community core, we're calling it Community Core Public Health Program that has 80 members across the state. Oh gosh, did I freeze?
No, you're good. Oh.
Well, I can go next in terms of round robin share. And I'm Amanda Ross. I'm also from Wisconsin, neighbors with Shelly. Our AmeriCorps program, we are in the east central part of the state. We serve the greater Appleton, Oshkosh urban area. So we're about 45 minutes south of Green Bay, roughly. And my meal that I would bring as a side to 4th of July, I have a BLT pasta salad that has like a cilantro mayo sauce with it. So that's been my new obsession that I'm telling everybody about. So
I could go next. Michelle Elise, part of NYC Service, which is in New York City. We're part of the mayor's office. We run a variety of AmeriCorps programs. I specifically work with the public health program in partnership with New York City's public housing residents. Yeah, we're all over the city, not state-based, but city-based. And one thing I would bring is just is tacos because I just like love like eating like meat with like seasoned meat and I always think it's like a nice touch with like a refreshing drink. So it's like the perfect combo for like a celebration. All right.
I love tacos. Tierney, have you gone yet? Introduced yourself? Sorry, I'll take over for Maika while she's getting her internet back on.
I haven't gone, so I can go next. But yeah, I'm Tierney Thomason with the National Association of Chronic Disease Directors. We do go by NACDD for short. And I'm actually calling in from Austin. Our organization is based in Atlanta, Georgia, but I'm in Austin, Texas. And the dish I would bring is also a pasta salad. So the one that you mentioned, Amanda, sounds so delicious. I feel like I'm always trying out different combos, and I don't have like a go-to recipe, but always just trying to see what I can throw into a pasta salad and taste good. So
I love that. Mine I shared in the chat is coleslaw. I think I make a pretty good one. I'm Liz Rose. I'm a portfolio manager. Maika kind of introduced me already. Anne can introduce herself, and then we have a few questions that we can dive into.
And I'm Andrea Koski. I'm also portfolio manager of the West region. I am in Tucson, Arizona, originally from La Crosse, Wisconsin. So great to see some Scotty representation. And I see we have a few other folks joining us right now. Laura, I know you're in the chat, but you want to give a quick introduction, tell us a little bit about your program. Go for it. Mike is back. Yay!
Sorry, Anne, were you calling on me?
I was.
Oh, so hi everyone. I'm Laura Proctor. I'm Associate Director for Training and Workforce Development at NNPHI. I said in the chat that I would definitely make my dad's pasta salad. So Maika, I'm glad you're back because we're gonna have a not pasta salad, potato salad. We're gonna have a potato salad off, and Aretha's gonna be the judge. And it sounds like we need a pasta salad off too at this particular cookout. So hi everyone. NNPHI is an AmeriCorps grantee, but I am not working on that side. I'm working on the COAG side where we've been updating the training plan, and I'm going to present some details about that to you all later.
And I can go next, Laura. Thank you. I cannot wait to be the taste tester for you and Maika. I love potato salad. So I'm like a potato salad connoisseur, so to say. So I am PHA's training manager. I'm Dr. Aretha Costley. I work with Laura on this initiative that she is going to share with us later on. So get ready for that. I live in Las Vegas and it is way too hot to cook anything. So I'm the chip, soda, pretzel person.
I hear that. Sorry, y'all, about my internet going wonky. Did we make it around the room?
I think we just did.
Awesome.
I actually haven't went yet, but I'm Deshae McMillan. I'm the National Training and Development Manager with the Hartford program. I'm with the American Heart Association. I'm located in Georgia, and we currently have 78 members. That's a part of our program, serving across 28 states. And I don't know, everybody said pasta salad, and that's what I was gonna say, but I'm kind of like, whatever you ask me to bring. So if it's pasta salad, macaroni, I can bring drinks, paper plates is even better. So whatever is needed.
You're my kind of invitee. Like, I love that person's like, what do you need? That's what I'll bring. So that's perfect. Welcome, Deshae. Thanks, y'all. All right, let's dive into this discussion. And then just in case my internet wants to take a vacation, Liz, thank you for being my backup. So I want to kick off the conversation with, what are your organization's training expectation for PHA members? So if we could keep this kind of brief, maybe like 1 to 2 minutes, but just like, what does that training plan besides the CDC train requirement look like for a member at your site or with your grantee organization? So I'd love to, does anybody want to volunteer? Otherwise I can just call on someone.
I can go first.
Awesome.
So yes, of course, we have the CDC train piece, but the way our training curriculum is designed, we kind of push a lot of the training, like asynchronous training requirements, into the first quarter of the experience so that I get a really solid foundation in those public health trainings. So in addition to CDC Train, we have a partnership with the YMCA of the USA to do some more kind of like more professional soft skills trainings through their Learning and Career Development Center. And so we do about a month or 4 weeks of trainings with the YUSA. But then aside from that, we also have like monthly training sessions with members throughout their experience on various public health topics, but also again, looking at some of the career development pieces like resume, tailoring, cover letter writing, interview skills, and things like that. So that goes out throughout the whole service member experience.
Oh, we love that. It sounds kind of similar to what we do in headquarters. So I love that y'all have such a thoughtful wraparound experience for your members. And is it Tyranny? I want to make sure I pronounce it right.
Yep, Tierney.
Perfect. Awesome. Amanda, do you care to share how y'all set up training for your members?
Yeah, absolutely. So just our program is a bit unique where we have members almost starting like a cafeteria style in a way. But we have pre-recorded orientation that members are expected to participate in just because of that continuous enrollment piece. But then as members are enrolled, we also have monthly trainings, and some of them are in person, some are virtual. And typically with those in person or with those trainings, we highlight a different area of social determinants of health, since that's what our program is working to address. So we talk about social determinants of health, and then in particular, we'd like to spotlight a local organization and highlight what they're doing to address social determinants of health in our community. And we'll bring in a speaker from the organization, and if it works out, we'll do a service project with them too. One thing we are trying to do, or enhance, I should say, for this coming service year is focusing more on those soft skills, or we just, within the state of Wisconsin, we just had transferable skills where it's looking more at like, how do you teach about critical thinking or communication or self-regulated learning? So hoping to incorporate some more of that into next year's training curriculum too.
Love that. Thanks for sharing, Amanda.
Yeah.
Shelly, may we tap you to hear how y'all are setting up training for your members?
Sure. So our first week for our members is all orientation. It's virtual since the pandemic. We've stayed virtual, and within that week of all the AmeriCorps topics, we have a partnership with the Milwaukee Area Health Education Center, and they certify community health workers across the state. And so they offer an introduction to community health workers and the skills and roles of community health workers. So they do about 12 hours, and we get to pick the topics, and they select expert presenters on those. And so this year we did, our first session was just like, what's the big picture? What is a community health worker, and introduction to public health? And then we did promoting health equity and cultural humility, working with groups and communities, health outreach and group facilitation, conflict resolution, self-care, and then 2 parts of mental health, because a lot of our members are focusing on that. Beyond that, after that experience, we actually offer them a scholarship to take the full community health worker training. It's a $2,500 course, and those who are interested and found the topics interesting and liked the career path, they start that in the early spring, and it's a 1-year training, so they actually finally wrap up after their service year has completed. But then they have a certified health worker certificate, and then we meet with our members monthly virtual, and we touch on soft skills at each of those monthly meetings, and we do 2 in-person events. One's a month after we start. We bring everyone together one day for, it's probably mostly team building and connecting. And then we also do a 3-day event in the late winter, put them up in a water park hotel, and we do a lot of professional skills, but we also incorporate lots of health trainings too. And those topics and speakers always vary.
Love that. Thank you for sharing, Shelley, and especially so Tashay said, love that you all can offer them that scholarship for the community health worker certification, and like ditto. Like we love when our programs are making that bridge from service to like actual jobs or skill sets or certifications into a public health career. So that's amazing. I'm gonna pass it over to Michelle. Are you available and can share about training for your members?
Yeah, so we have a professional development team and our staff that kind of does trainings for all of our members combined. So in total, I think we have about 4 America programs, and usually they're all included in the same orientation. This year was about a week, and each month they set up a whole training day filled with different speakers, kind of to teach them more like soft skills, and also just more about professional development. And we also offer a voucher for them to take an Excel class depending on their level. Some of the hosts that we work with offer additional training to their members specifically in terms of them being certified to become a community health worker. We also do a bunch of more tinier, like more intimate cohort calls for members to just like interact with each other and have different speakers from different like agencies talk about resources. So it's quite a variety. We also offer the Cornell training for the members to take. Of course, that's valued, I think, over $3,000, just kind of to give them the extra push of public health knowledge. It's optional though, but that's pretty much it in terms of training. But there's a lot of opportunities for them to take advantage of.
Amazing. Love to hear it, Michelle. Thank you for sharing. Alexis, are you there and able to share? All right. Maybe Alexis had to step away. Deshay, you are up. Oh, Alexis, are you there?
Yes. Hi, I'm here. I'm Alexis Smith. I am from Sinai Health System in Chicago. We kind of focus on orientation during the first week, getting to know more about the hospital and the AmeriCorps program. And then we introduce them to the CDC. And then they have like departmental training. So we have members placed with our senior service program. So they get a chance to see, what PHA looks like on that end. So in the different areas, there are also departmental training. And then throughout the year, we'll have certain workshops of professional development.
Amazing. Thank you, Alexis. And then also I want to encourage folks who are listening, if you're like, hey, I wanted an additional detail, who are you partnering with? Like, feel free to hop in. This is like an open space. This is just a conversation, pretend that we're sitting around a virtual table. Deshay, please, the floor is yours.
So, of course, beyond the CDC trainings, we have our American Heart Association Heart U professional education platform. So members are required to do some courses on that platform as well. And then right off the bat, as many have said, we have our pre-service orientation right at the beginning, which ours is a 2-week virtual live. We use our AHA colleagues that are, specialized in certain areas, but it's a 2-week live training where members are with us face to face. And of course, we touch on all things public health. Of course, our priorities: tobacco cessation, nutrition, SNBP, self-measured blood pressure, CPR training. We do comms, health equity, This is just to name a few. As you can imagine, we go through a lot of trainings in 2 weeks, but professional presence, motivational interviewing. Once they transition out of those 2 weeks PSO, we then go to a biweekly member development training where we kind of continue building on those public health practices and professional development. Of course, touching on things like mental health and the gamut. And then we actually just had our first in-person retreats. As I mentioned, we have 78 members across 28 states. So it's rare that we all can get together, but we're trying to have every year we're in year 2. We weren't able to do it for year 1, but year 2, we were able to bring everyone together in Dallas at our national headquarters and do a almost 4 or 5 day in-person retreat where we fully certify them in Heart Saver, CPR, so they were already able to get their certification, and of course, some additional trainings, some other health equity trainings. And then we do offer our members the opportunity to get their mental health first aid cert, which is a 3-year certification. And then we began offering members the opportunity to become CPR instructors and receive their instructor training. We have a lot of members that are in communities, rural communities, wanting to teach CPR, so they have an opportunity now to get their instructor training, which is cool because they can take it away once they're done and start their own little business with this certification. So just different things that we're doing, but we are always busy in the training world.
Yeah, it sounds comprehensive, but it's exciting to hear all of these additional training orders from different organizations. I would hear from perspective, like, what do you think makes your training successful? Like, what's the special sauce of what you're offering to members that you think is really not only equipping them to do the work that they need to do, but to go from service to career? So I'll leave the floor open. Oh no, I don't want to call on anyone. Alexis, would you like to share what do you think makes your training particularly successful for members? And what's the secret sauce for your kind of suite of trainings that are offered to members?
I think the one-on-one departmental training, that way they get a feel for what's going to take place directly in their department, not an overall aspect of the hospital. We also encourage them throughout the year to apply for any jobs that they may qualify for, or if they want to know more about the position, we'll also connect them with the director.
Awesome. Anybody else care to share their training secret sauce? Okay, let me throw out another question. How are y'all? Oh, sorry, go ahead, Tierney.
Oh, I was just going to say, like, similarly to Alexis, like, we have our monthly all service member training opportunities during our monthly meetings, but we also meet one-on-one, or our team. So it's myself and our program coordinator meet individually with service members every month just to get a feel for their personal goals and also just, how they're incorporating what they're learning in the trainings to their actual service learning experience and kind of connecting those two pieces. But then as we get closer to the end of their service, like really focusing in on what types of jobs they might be looking for, what career interests they might have. And so then kind of taking that more tailored approach to the training and helping them with their own resumes and being on the lookout for jobs, just trying to connect them to opportunities and things like that. But yeah, just wanted to highlight that I think the one-on-one like coaching mentorship piece has been well received.
How do you all? Oh, sorry.
You are still here. I thought that you may have disappeared.
No, I was like, let me reduce the work on my internet. So I'm off video. I'm sorry, y'all. How are y'all making the connection for your supervisors to create that one-on-one mentorship space? So when we think about people offering this across host sites and across organizations, are there any resources or training that you're providing to supervisors to create that mentorship relationship and set expectations. If any of y'all could share on that, I think that'd be really helpful.
This is Deshay. Yes, we do offer our, well, ours is a little different because we are across so many states. So our members have a AHA field supervisor that's located in their regions. And then of course they have a host site supervisor who's at their actual site. And so we do offer trainings for both. To just give them the opportunity, more trainings for our internal AHA staff, not as many for our host site staff, but we're learning that a lot of our supervisors are emerging leaders and maybe haven't had this experience before in supervising service members. And so we've just implemented a training platform for our field supervisors where they'll be able to, really it's an emerging leaders training. And so we just began to identify, okay, we have a lot of expectations for our supervisors, but yet we don't necessarily offer them the training because we make the assumption that they know and then they don't. So we are in the beginning stages of our supervisor trainings, but if anyone has any expertise in that area, definitely looking forward to hearing what you all do for your supervisors.
I can share a little bit from our experience too. So we also provide an orientation to our supervisors. And in addition to that, we provide a lot of template resources to help guide them through the service term. Like, for example, in the first 2 weeks, we ask them to create a service plan with the AmeriCorps members. And we provide templates for that and templates for other things. Like if there's a performance improvement component, we have templates for that. And then I also just have a lot of informal check-ins with our supervisors to see how things are going, if they need any additional support. And then in addition to that, we have sometimes, ideally quarterly, but if scheduling doesn't always work out, quarterly like group calls with all of our supervisors can come together and talk about how things are going at their site and with their member. And then they can talk about like best practices and stuff. And we've had a few AmeriCorps members who've been in our program that are now supervisors for their members. So they got like hired onto their host site organization as an employee. And now they get to supervise the members. So that's been cool to see that all come full circle. But that's some of what we've been able to do to support our host sites.
I love that, Amanda. Super helpful. Any other recommendations from the group as people are thinking about what they do to prepare their supervisors? What resources do they provide to them to kind of outline expectations for like a mentee mentorship relationship? Amanda, you kind of mentioned some templates that you have. Is that something that you would care to share with this group? If you sent it to me, I can share it out with this group and more broadly as inspiration.
Yeah, I can do that.
Awesome. That would be really great. Thanks, Amanda.
Well, and I hope, this is Shelley, and I hope that you would continue to offer the NACCHO Successful People Management course. We shared that with our supervisors, and we had a handful of them take the course, and one so enjoyed it, said she's going to enroll again if given the opportunity, just to really solidify it, because there was a lot of valuable skills in that course. So thank you for offering that.
Thank you for that feedback, Shelley. Yeah, that is something we could certainly ask NACCHO if they are able to offer again. So thank you for flagging that it was so valuable. Well,
I think that kind of underscores the importance of really reading the PHA emails too, because it would be nice to get some of that information a little sooner than we receive it, but it's usually got just chock full of stuff for members and for supervisors, I think.
Absolutely. We'll do our best. Once we know, we definitely try to throw it in there, but it's true. Sometimes those opportunities, you only got 2 weeks or a week to get in there. But feedback taken, Shelley, we'll do our best to give y'all as much lead time as possible, for sure. We are rounding the bend on this discussion piece of our programming. I just wanted to open the floor. Does anyone have any questions for one another? Like, I've thrown out a lot of questions, but do y'all have any questions for each other about how folks are operating their training programs and how they're enhancing them and making them better? So I just want to give a few seconds to that. Okay. The last piece the last question out there is, has anyone collected data about their training program? And how have you used data to pivot or update or shift your training?
We actually have, this is Deshay with the American Heart Association. We conducted, well, not the hardcore staff, but our evaluation team at the end of their term conducted focus groups to get feedback, focus groups and surveys with our members just to get feedback on how they felt, particularly training, the overall program, or particularly training went. And so a lot of the feedback that we got helped us in year one, helped us to implement our new practices in year two. So one of the things was members were like, we're all spread across the world. We never get to meet with each other. And so that's why we did our in-person retreat this year, where we brought them together for 4 to 5 days. Some other feedback was mentorship. So some members that maybe are newer, if we have some returning members, liking the ability to be able to be partnered up with some of those alumni members for mentorship. And so we've implemented a mentorship program. And something else that we had last year, but it wasn't used as heavily, but this year our members absolutely love it. We have a all team group chat. And literally it is like, I have to put it on mute some days because there's so many questions coming in from members. And it's like, I have to go to the library today to do an SNVP program and I need resources for X, Y, and Z. And then everybody's like, well, I have this, I have this, I have this. And so it's literally become like, last year I used to have to drop in a question of the week to get them to talk. This year I'm like, I can't get you all to stop talking. So it's been great, but again, some of that data that we were able to get from our evaluation team really helped inform our planning for this year and how we can get members more integrated, because it is hard when you're virtual and you're across the world and you don't get to see these people every day, you know, at least your colleagues every day that's doing the same work as you. And so it's been working for us. And I will say, when we got to retreat, they had never met each other in person, but it was like we were one big family. We all just meshed. So it seems to be working what we've implemented.
Oh, we love to hear it. I love that. I see Aretha has a question for Deshay. Before I do that, Aretha, Tierney, you came back on video. Did you have something you wanted to share?
Oh, not particularly, but I'm happy to share. We do collect data on the training plan. So we have like a general survey that we complete, but also met with we have like a service member advisory council of members that just wanted to like have that extra layer of participation in the program and kind of rise as leaders of the cohort. And so we took their feedback specifically and incorporated into the plan. So we used to have the training plan more as far as the asynchronous training plan, like spread out over the first like quarter of the service year, but they expressed, you know, between the CDC TRAIN platform, the YUSA platform, and then we also have an NACDD learning platform too. And they said it was confusing about like how, like which platform they needed to be in at which times, and just, so that's why we ended up pushing the training all into Q1 so that they could kind of get the majority of their training out of the way before like really diving into their service learning experience. And because they also expressed like that the monthly meetings are a great training opportunity and that they would like more opportunities to connect with each other, collaborate, have group discussions, like small group breakout rooms. And so we adjusted the training plan in that way just to give more time within those monthly meetings for like a collaborative approach to training.
Love that. Thank you so much, Tierney.
Maika, I think we lost your audio again.
If we want to continue, does anyone else have anything more to share about how they have adjusted their training or use data or how they collect data while we wait for Maika to come back?
And real quick, Liz,
Yes.
she lost audio, so I'll go ahead and take over. But thank you. Yeah.
Thanks, Aretha.
Okay, so she said it's Laura's turn right now, and that's what
Oh,
she's
perfect.
telling me.
Yeah,
So
great.
just real quick, Deshay, about your app. Is it the GroupMe app? That's the only question I had for you.
I was actually just dropping in the chat. Actually, no, we use Microsoft Teams. And so because that's just the platform that AHA uses for communication. So we actually have a group chat just housed right on Microsoft Teams. We did have a GroupMe for our retreat, but I shut it down after retreat because getting messages at all times of the night. And it's like, I don't want to talk about work after work. But they do use the Microsoft Teams chat very heavily. And so that's the platform that we use.
Okay, great.
And they're able to drop in, of course, like pictures and files and different things like that.
Okay, well, thank you so much for that. I was just wondering, but before I take up any more time, I want to go ahead and say thank you for all of your training expertise and all of the things that you've mentioned that you do at your organizations. It's greatly appreciated, and I know that the members are getting some really fine-tuned, well-crafted training just based on the things that you shared with us. So without further ado, I'm going to go ahead and turn it over to Laura. She's the second part of this particular webinar. So Laura, go ahead and take it away.
Thank you so much, Aretha. Thank you, Steve, for sharing those slides. So hi, everyone again. Like I mentioned, I work with the National Network of Public Health Institutes, and we were funded through the CDC to take that CDC Foundational Public Health Training Plan and update it just based on the first year's data, what we've learned about the training plan and how people are using it and responding to it. So if you could go to the next slide, please. So our task was to update the training plan. And, early on, we kind of realized that updating a full training plan or even evaluating a full training plan is really different from just evaluating and updating like an individual one-off training. So we went through several steps. It's been kind of a long process, but we're happy to be close to the finish line here, and soon we'll have a completely updated training for the AmeriCorps members, and Aretha will talk a little bit about how that transition will work. So the first thing we did was we conducted an assessment of the current training plan and figured out where we had opportunities to collect and access data. Then we conducted a formal evaluation of the training plan. We thought about what questions we wanted to answer, how we could collect this kind of information that we're looking for. Then we analyzed that data and made recommendations for improvement. We prioritized those recommendations just based on what we thought we could do most effectively. And then we have been in the implementation phase of making those changes since. If you could go to the next slide, please. I'll talk about each of these steps in a little more detail. And hopefully this gives you some ideas about what's coming down the line for members, and also how you might be able to frame evaluating the training that you're giving them on top of the training that PHA provides. So again, just to recap what we've done last year, NNPHI, through funding with CDC, engaged an evaluation partner, Cardia, to conduct a formative evaluation and understand the training plan's effectiveness, completeness, and perceived usefulness. So these are kind of the three factors we decided to look for in terms of the training plan. And I think also when you're considering if evaluation or any kind of assessment of the trainings you're offering, you might want to consider kind of these 3 points as well. Effectiveness, kind of meaning like, okay, you take this, you sit through all these, we know that it's really long, you sit through all of these hours of training. Was that an effective use of your time? Did you leave with meeting the learning objectives that we've set out? Completeness, we're calling something a foundational public health training plan. Did we meet all of the marks to be able to say this is kind of a complete public health 101 entry to public health? Would you leave this training plan with kind of a complete sense of what public health is all about? And perceived usefulness. We also wanted to know, according to PHA partners, grantees, training participants, and some of our other national partners, is this a a useful training? Is it useful for people to go through this many hours of online asynchronous training as a part of their service experience? So the findings and recommendations from this evaluation informed all of the updates that we're making and the development of additional content. So the first thing we kind of realized is that while we had a lot of data from the TRAIN system about whether people completed the training plan, we didn't have a lot of other like substantive user data that helped us assess these 3 points: effectiveness, completeness, and perceived usefulness. So we determined that focus groups and interviews would be the best approach to understanding those changes. We decided to conduct focus groups with PHA members, and we broke those out into focus groups versus interviews just so that we could have like a group of people in a room and kind of feeding off of each other, kind of reminding each other kind of what they went through with their training, because they might not always remember. We broke out the focus groups into people who had some foundation in public health and those who really didn't. We did interviews with site supervisors. We talked to our national partners. And another part of this work, which is worth mentioning, but it doesn't really affect what we're talking about here. But CDC, when they released the training plan, they also released a public access training plan. So you should be able to access that through CDC TRAIN. We're updating that as well. If you have, people on your staff who are not part of the AmeriCorps program, well, they can also go through this training plan as well through the open access training plan. So we made sure that we set some interviews around that as well. So through these conversations, we looked at data, the data that we had access to in TRAIN. We wanted to consider these kind of key questions, like how many people were registering for and completing the PHA and the open access training plan. How useful do participants, grantees, supervisors, and national partners find the training plan? How well do the training plans support the development of skills and capabilities for foundational public health programs? And how well do the training plans support new public health professionals in identifying viable public health career pathways? And what are the strengths of the training plans that can be expanded? So again, I think these 3 points, and then the kind of key questions, feel free to, I think anyone can kind of take these and adapt them to the trainings that you guys are doing in your own sites, and thinking about how you want to assess the usefulness, completeness, and effectiveness of those trainings. So we go to the next slide, please? So that represents steps 1 and 2, which was considering the data that we did have, expanding on that to collect more data. Then our evaluation team put together a findings report and recommendations. And so we worked really closely with both CDC and Public AmeriCorps to parse out these recommendations and figure out what we wanted to do with them. So on this slide, I'm just going to talk about these at a really high level, because on the next slide, I'm going to go through in detail where we took each of these. But from the evaluation, it was determined that we could improve the consistency of members' experiences, explore possibilities for better integration within the platform, engage learners through more interactive or moderated community of practice, include more videos that feature public health professionals with diverse lived experiences, consider designing differentiated learner pathways, integrate additional optional content to align with specific learner interests, and develop approaches to encourage training plan completion that support members in their career trajectory. So if you go to the next slide, please. So we looked at which recommendations we could respond to within the context of the training plan, and which might need to be addressed through other means. So the first recommendation was to improve consistency of members' experiences through resources that support clearer communication between site supervisors and members through simplified and clear registration guidance, orientation materials, and information about how to request timely technical assistance. we're responding to this through something that we call the Atlas. So it'll be kind of an accompanying guidebook for members as they go through the training plan. They should be able to reference each section of the training plan. There's going to be guidance on like how to talk to your supervisor about what you're learning in the training plan, and then just information about how to access technical assistance. Like, what are the frequently asked questions? When do you go to train technical assistants versus your supervisor versus PHA if you have questions? The next is exploring possibilities for integration within the CDC TRAIN platform to minimize confusion amongst learners navigating through the courses hosted external to CDC TRAIN. The learner experience could also be enhanced by offering a wider variety of learning modalities to accommodate different learning styles. This is one where the nature of this training plan is that we conducted an environmental scan, found trainings that existed within these topic areas, selected the best ones and mapped them to our learning objectives and competencies. We can't really change the way that CDC the TRAIN platform is set up. So there will be a need for people to then still link out to external training platforms and create multiple different user accounts. We can't really make that change within the context of this work. But what we can do and what we are doing is reframing that as a learning experience. So the members should be getting familiar with where training exists for the public health workforce through this training plan. We also, through the aforementioned guidebook, will list out everywhere where they have to make an account or save a password to kind of help them be better, keep that better organized and give them like a heads up. And as far as offering a wider variety of learning modalities, we also saw through the evaluation that people want access to things that PHA is providing. So a lot of the webinar series or a lot of this like kind of supplementary stuff, we just want to make sure that through this guidebook as well, we're making sure that they know where that is. And I realize I am rapidly running out of time. So I'm going to go really quickly because I've got a couple more slides and I want to make sure that Aretha has time for the next section. Engaging learners through, but I'm happy to take any questions on or offline after this. And there will be a lot more information coming our way about what the updates are. Engaging learners through an interactive or moderated community of practice. Through CDC TRAIN, we can have discussion boards. They're not really going to meet this recommendation. So it's something that we can suggest to PHA that they have opportunity for the kind of peer exchange that people are looking for, but we will be providing discussion guidance. Include more videos that feature public health professionals with diverse lived experiences. We are including a number of videos throughout the training plan to help guide people through and give them an overview of the content that's coming up to help them better kind of situate themselves within the training plan. Consider designating differentiated learner pathways. This came up a lot because some people come in with public health experience and some people come in with none. We had to ask ourselves the question, do we create multiple different learning plans and have people have a system for people to select into one? Or is our objective that everyone leaves this training with the same kind of baseline knowledge? We went with option 2, or we went with the decision that we want everyone to leave with kind of the same foundational knowledge. So the decision was made to create one training plan or to stick with one training plan, but there's kind of a choose your own adventure aspect of it. So within each section, people will be able to make decisions about some optional trainings that they'll be taken, and those come within different modalities as well. We're integrating additional optional content. That's what I just spoke about. And we're also considering formal certificates. That's not going to be a part of this one, but we are going to have the ability for people to get a LinkedIn badge after they complete the training plan. So sorry, I went through that so quickly, but there's a lot going on. So go to the next slide, please. So again, just the Step 5, implementation. We are updating the content. So we're making some training swaps, just some things, some of the trainings weren't as engaging, and we tried to replace those with more up-to-date trainings. We're adding additional video content. We're doing the member atlas, which we discussed, which will include an individual development plan so people can think about their personal goals and career goals. And there's going to be some built-in flexibility within this training plan. The completion time is 17.5 to 18.5 hours. The range is because people will be able to make decisions about some of the content that they're experiencing within the training plan, and then some additional optional content. So next slide, please. And then finally, we have some recommendations. I think somebody mentioned in the chat that we're working with Cornell to do some like supervisor guidance. And we've kind of laid out some bullet points around what a member might be responsible for and what a supervisor might be responsible for. So members should take responsibility for their service learning, including completing this training plan. They should receive and integrate feedback from their supervisor. They should integrate learning and other relevant information into their projects. They should demonstrate a commitment to continual learning. Supervisors should be there to ensure that a member has regular protected time to engage in this kind of learning. They should be providing actionable feedback on performance. They should monitor their understanding of these concepts and how they apply to their work. And they should support continued professional development. So I think that's, go to the next slide, please. With that, I'm sorry, I ran past my 10-minute allotment. I will pass it off to Aretha. And thank you so much.
No, thank you, Laura, because you covered a bunch of the stuff that I'm going to talk about on this slide. So just as you see, there's a process to creating training, and Laura's team and with our partners from the CDC and her subcontractors were able to make the training for our members a little bit more current and more relevant in this evolving world called public health. So here are the updates for PHA's Foundational Training Plan. And Laura has went over a lot of these things, but there's two things that in particular that I want to draw your attention to. So the very first thing is the current plan's number is 5390. So if you're talking to your members right now, they're talking about this current plan. So once this plan is retired, anyone that registers for the PHA training plan after 1 August will be on the new plan. And the new plan's identifier is 7484. So that gives you an opportunity to discern which one of your members are in the 5390 plan, which is the current plan, and which one is in the 7484. So the main differences here, as Laura just mentioned, the old plan that everyone is in right now has 16.1 hours of required curriculum. So anyone who's registered for the plan prior to July 31st will finish this plan before their service term ends. Now, this updated plan, once a member comes on board 1 August and beyond, this is where they're going to register for 7484. In fact, right now, what I'm doing is I'm updating the links, I'm updating the FAQs, and it will have the link with the new identifier number in the FAQ. So all they have to do is click it and it'll take them to the new plan. And like Laura said, because of the choices, it's kind of like create your own learning journey. You know, the curriculum is 17.5 to 18.5 hours, depending on what they select that piques their interest as far as in that particular domain. So like Laura had mentioned, the feedback that was given from the focus groups and the interviews was they wanted something a little bit more flexible. So again, we sat down and we worked on how can we create a current and relevant plan, but still provide learners with the flexibility to still learn the information that they need to, but at the same time, dig in a little bit deeper to things that they really, really want to find more information about. So next slide, please, Steve. Thank you. So what's next? First and foremost, members do not have to do anything. We're not asking them to, transition on their own or anything like that. What's happening, like I said, anyone who registers after 1 August will automatically go into this new plan because that's the only one that they're going to have access to. So right now, if they're unregistered, then they need to get registered now so that they can finish their CDC TRAIN foundational plan prior to the end of their service term, because that is a requirement. So right now, current plan 5390, they log in, they monitor all of their training. At the very end, one thing of note is make sure that they go to that last course there and get their certificate, because if they don't, then it's like they didn't take it. So they have to finish everything to include that last one. So the question on the slide here says, can members take both plans? We don't recommend it. They need to take one plan. Now, I will say this. If they are a go-getter and above and beyond type of person, after they finish their requirement, then if they want to take the second plan just to kind of see what's in there, they can take the public-facing plan and do it on their own time, do it, on the train, on the bus, whatever they want to do it, however they want to do it. But the recommendation, the requirement is one plan. So again, anyone who's registered before July 31st this year takes the 5390. That's the current one. Anyone after 1 August will take the 7484. That's the updated one. Last thing, as supervisors, as organizational owners, we encourage you to check in for the status of your members, because life happens, right? We know that. And so sometimes you get a little bit caught up in the work that you do and, oh, I forgot to do that. And you don't want them to rush through the foundational training at the very last minute. So just kind of do some check-ins, maybe every week, maybe bi-weekly, just to say, hey, where's your status? What part of the training plan are you in? How can I help you get to that end? So that's the only recommendations we have. It's going to be a great updated version, lots of resources. So please check in and encourage them to get involved and engaged into learning about public health. Next slide, please, Steve.
So
Mike, are you back on?
I'm here.
Okay.
Thanks so much, Aretha. Thank you, Laura. We are 4 minutes over time, so apologies, y'all, for going over. If you have any questions, we can hang out here to answer any questions that folks may have, but I do want to officially wrap this webinar time together. So thank you for hanging out with us. Thank you for engaging in a really lovely discussion. And we are here to answer any questions that you may have. So Steve, has put up kind of my informal poll here. We want to know what y'all want to talk about. So if you could go ahead, tell us what the next grantee exchange should be about. We will go ahead and make sure to do the topic that's most popular. So as you're filling out your poll, I want to release y'all. And please, 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 if you have questions, we're here to hang out and answer them. So thank you.